Welcome back. This morning, growing alarm in the medical community ahead of an expected White House announcement on autism.
I think we found an answer to autism. We're going to be talking in the Oval Office in the White House about autism, how it happens, so we won't let it happen anymore.
Now, according to 4 people familiar with the matter who spoke to the Washington Post, the White House will link pregnant women taking acetaminophen, the active ingredient in Tylenol, to an increased risk of autism in children. Current FDA guidelines say acetaminophen is safe for pregnant women to take, and that's backed up by decades of research. In a statement, Tylenol's parent company, Kenvue, tells NBC News without the drug, quote, women face dangerous choices, suffer through conditions like fever that are potentially harmful to both mom and baby, or use riskier alternatives. Let's bring in Dr. Vin Gupta, a pulmonologist and MSNBC medical contributor. Doctor, we've all been told Tylenol is the safe pain reliever to take when you're pregnant, and any possible link between that and autism has been thoroughly studied before, right? What do we know?
Donna, good morning. What we know is that there's been years of research prior to recently that's shown a correlation but not causation of Tylenol and maybe a very small increased risk of a baby developing autism, very small. And those were poor quality studies, poorly designed. What we also know is that science changes, research gets better. And just a few years ago, one of the largest, best quality research studies ever done, 25 years in Sweden, looked at siblings, one exposed in utero, the other not, to Tylenol. And what did that find, Anna? When controlling for genetics, family history, maternal, paternal age, known risk factors for autism, that there was no link. So the best quality research has shown no link between the use of Tylenol in utero or during pregnancy and the development of autism.
President Trump actually seemed to acknowledge this weekend that today's announcement could be wrong. Take a listen.
I don't want to wait any longer. We don't need anything more. And if it's wrong, it's right. It's not going to be wrong. But if it is wrong, it's fine that we have to do it, because we're going to have an announcement on autism.
Dr. Gupta, your reaction. What are the implications if they make this link and they're wrong?
Well, it's going to be a similar line of things. You and I have talked about this endlessly of using a similar approach. They don't know. They put something out there and it's cherry picking data. I worry about women across the country, Anna. You said this in the tee-up. There aren't many options for oral pain relief if you have to take a medication. I say this watching my wife go through 2 pregnancies and needing, in some cases, pain relief. That it's important to treat pain during pregnancy. That's a risk factor to baby. And NSAIDs are not an option. Other pain relievers are not an option. There's not a lot there beyond hot and cold compresses, acupuncture, and Tylenol to treat pain. So we can't just do this willy-nilly. We have to be serious about it. And frankly, there is no link when you look at the best evidence.
And we should note, countless medical organizations from the U.S. to Canada to Europe have all said that the data that even suggests a link is inconclusive at best. But for those people who may be fearful and say any risk isn't worth it, what should they do?
As always, they should speak to their most trusted purveyor of medical information, Anna, and whether it's childhood vaccines or the use of Tylenol in pregnancy. If you have a question, no doubt patients across the country are confused by the last 6 months of constant revisiting things. And, personally, I don't think we should be revisiting, but have a conversation with your medical provider, either your child's pediatrician when it comes to childhood vaccines or your own obstetrician. You pointed it out, Anna. The American College of Obstetrician and Gynecologists are looking at the same exact data, that there's no concern for using the lowest effective dose of Tylenol, if you need it, to treat your pain.
Dr. Vin Gupta, as always, thank you for being a trusted resource for all of us, and thank you for bringing us the science. Appreciate you.
Thank you.